Good afternoon, everyone, and thank you for joining us for this COVID-19 virtual community conversation. I'm Mayor David Haubert, and we have a great lineup today of insightful information for you. Anybody that's joining, we have some questions already offered in advance. You can send them in, or as we go through this, go to the chat room and type in any questions that you might have. But thank you for joining us. We try to be as open and transparent and provide as much information with the community as possible. So we've arranged for a great lineup. Joining us here today is with an update on COVID-19 and everything going on in Alameda County. We have the Director of Alameda County Public Health Department, Kimi Watkins-Tartt. Thank you for joining us, Ms. Watkins-Tartt. We also have the City of Dublin Police Chief, Garrett Holmes, and our city manager, Linda Smith. They will provide updates on how things are going here in the city of Dublin. Miss Kimi Watkins-Tartt providing a great overview from the Alameda County Public Health Department perspective. With that, I will say welcome to everyone watching. Welcome to our panelists. Thank you again. And please, let's start with Miss Watkins Tartt giving us an update on COVID-19 in Alameda County. Thank you so much again for being here.
Thank you, Mayor, for having me. I just wanted to say thank you to everyone for all of the sacrifices you all have made in helping to make Alameda County healthy and safe for everyone. We know that this has been difficult, and we want to also say that we really are encouraged by not only the numbers that we are seeing, but also the efforts that you all are making. And so again, I just want to thank you and let you know that we know that this has not been easy for anyone. Our Healthcare Services Agency is now in its 16th week of emergency activation. And we have spent these last 16 weeks, I know it seems like it's been a lot longer than that, but we had our first case March 1st, and we are now in week 16. And we have spent a lot of time really building out our response to be appropriate to this pandemic. And we have made a lot of really good strides. Last week, we took the first step toward easing some of the restrictions and allowed a limited number of low risk outdoor businesses and activities and construction to resume in Alameda County. This became effective just this past Monday on May 4th. As you all know, our governor has also issued guidance for allowing curbside retail activities as early as today. While we in Alameda County won't be matching the governor's actions, we're continuing to plan for and working toward the next phase of allowable activities. I want to pause and just say a little bit about the approach that California is taking with regard to guidance being provided at the state and each county making different decisions. There are counties in Alameda County that have very, very few cases and no deaths. And it's important for our state to have that general direction that was provided by our governor, but it's also important for us as a county to be able to make decisions based on what's true for us here in Alameda County. And so for that reason, we, along with the other Bay Area counties in our area, have decided to go at a slightly slower pace. However, we have identified regional indicators that we're going to be monitoring very closely to help guide how quickly we open certain activities and when we open those activities. We're also going to be putting in place a regional dashboard, and we're hoping that that will come along pretty quickly so that we can share publicly how we're progressing. And I just want to tick through the 5 indicators that we're monitoring that will help to inform what our next steps will be. First, we're looking to see whether the total number of new cases in the county are going down or flattening. Our trend of new cases per day, or our epidemic curve, continues to decrease, over the 2 weeks, over the last 2 weeks actually. And the trend for hospitalizations is flat with slight decreases over the last 2.5 weeks as well. Second, we want to make sure that we have sufficient hospital bed capacity should we need to surge. And we've done really well in this area, and we want to maintain that to really make sure that we are able to hospitalize people and to make care available to people who need it. The third indicator that we're monitoring is our testing capacity. We would like to be able to do 200 tests per 100,000 residents per day. For Alameda County, that's about 3,100 tests per day for a county of our size. Fourth, we want to meet certain thresholds with regard to case and contact investigations and ensuring that we can support people in isolating and in quarantining. And many of you have heard us talk a lot about contact tracing. That is the way in which we identify those people who have been exposed to people who have tested positive for a disease like COVID-19, and we're able to provide them the resources and support that they need to quarantine and stay away from others, as well as monitor them to see if they are developing symptoms. Our goal is to be able to reach 90% of all positive cases and ensure that 90% of all people who test positive can isolate safely. The second goal in this area is to be able to reach 90% of all contacts, all those people who came into close contact, not just general incidental contact, close contact with positive cases. We want to be able to reach 90% of those, and we want to make sure that those 90% of those individuals can also quarantine very safely. Finally, we want to make sure that we have a 30-day supply of personal protective equipment for all healthcare workers. So these are the regional indicators that we're going to be monitoring very closely to signal to us when we can open our community back up, allow certain activities to happen. And I think I'll stop there. I think you all have a lot of questions about what this means for Alameda County. And so I'll stop there and say again, thank you very much for everything that you have done. We have done really well so far, and we want to continue that trend.
Ms. Watkins-Tartt, I'll let the staff come up with the questions that have been asked in advance, but could you just, if we could walk through this, it seems to me that 1, 2, and 3, we were doing pretty well on. Number 4, I'm not sure if you could say, where are we on the capacity for case contact and tracing? And then could you review the 5th one as well? Again, are we close to getting this, or where are we?
So I'll start with the 5th one. We're pretty close. I think we're making good headway around the 30-day supply of PPE for all healthcare workers. So this is through partnerships with our health system partners, through a deep relationship with them. I think that we're very close to getting there, but we want to make sure that we have a steady supply. We can always have that. So I'm feeling pretty good about that. But again, I wouldn't check that off as that's done and done. The 4th indicator is where we have the most growing to occur. That our contact tracing and case and contact investigation operation really needs to expand in order to manage what we believe will be the scale of this pandemic in Alameda County. I think one of the questions that I received was, as we test more, we'll detect more, and that is true. And so for more testing, with more testing, we get more detection, and then we have to have the capacity to follow up, to support those individuals in isolating and quarantining, and we have to be able to do the contact tracing for all those additional people. Our contact and tracing, our case investigation staff unit usually is a staff of 7 people. And over the time of this pandemic, we have scaled up to a team of 60 people. We need to scale up even farther to near 300 people. And we have gotten an outpouring of people from the community saying that they are interested in being trained as contact tracers, that they want to be involved. And we will be looking at ways to engage and involve community partners, volunteers, residents, and individuals who are really interested in helping with the effort. But that is a heavy lift to really create a much larger apparatus than we have currently, but we are making good headway in that arena. The metric that I spoke of inside of case and contact investigation is that we want to be able to reach 90% of everyone who tests positive. We get that information from our healthcare providers and testing sites. They collect information from individuals who are being tested. Sometimes the information is incomplete, sometimes it's not accurate, sometimes we can't reach people. And so we're really working very closely with all of the providers to make sure that the information that comes to us is complete, it's accurate, so that we have a better outcome in reaching all the people that have tested positive. And we also want to be able to share that information with the public so that you all can see this is how we're doing with regard to reaching people who test positive and reaching those who they've had contact with.
So if we currently have 60 and we need to get to 300, so we have a lot of hiring to do. We have to find them, train them. It sounds like that might take a while. So we might not quite be there yet. But do other counties have that same metric of, and have they staffed up to that, roughly equivalent 300 on an equivalent size county ratio? Do they already have their 300, or are we holding ourselves to a higher standard than other counties?
No, the 300 number that we came up with, and I can't quote the actual formula that was proposed. We're all pretty much using the same calculation of what our contact tracing operations should look like. And no, we're not holding ourselves to a higher standard. And I can say that many of the counties throughout the Bay Area, as well as the state, are also working diligently to ramp up their efforts. Larger urban areas like Alameda County, it's a heavier lift than it is for smaller, more rural counties. And so some of those communities may be very close to reaching their staffing goals for their case and contact investigation units. But in the larger areas, we are all in pretty much the same spot. However, we should not be thinking of this as Alameda County attempting to hire directly to the county 250 people.
Yeah.
That would not, yeah, that would be very difficult.
Contractors will work with others, partners. We have friends.
Definitely be working with a lot of partners, as well as there may even be some workforce that is provided to us by the state. And so we're going to be using a mix of things, but I don't want to scare everyone into thinking, oh my God, they have to hire 250 people into county government. No, that's not how we're going to get there.
Okay. Do you need special training to be a trace contact person? Can anybody figure out how to do that? And maybe whether they call the county or call one of the partners, whoever they call, if they're willing to help. You mentioned people wanting to help out. I agree. There's a lot of people who want to step up and help out. That would be great.
Yes.
To steer them in the right direction.
We will have very detailed training. The state has also is putting out Contact Tracing Academy that will be a part of our training package. We will also make some customizations for Alameda County. And you don't need a public health background to be a good contact tracer. You don't need a communicable disease background to be a good contact tracer. The contact tracer is a person who calls you on the phone and really puts your mind at ease, shares some information with you that could be scary, and asks you questions So we're talking people who have really, really good interpersonal skills, who can get trust over the telephone. We're talking about people who are compassionate and patient. And there are so many people in our community who have those qualities. And so,
There are, and there's a lot of people that don't. You got to get the right person, right?
yes, we do. We do need to get the right person, but you don't have to have special public health training or infectious disease training for this, but we will train everybody who we include in our unit.
Okay, I'm sure we have lots of questions from the community, the audience. Ms. Smith or Mr. Stefanski, who has those questions?
So, Mayor, I have access to those questions. We had one pop up in the webinar chat, which addressed one of those key indicators where you were speaking about the 90%, and they were asking why 90%. I think you answered that question because it's really about trying to find the people, making sure that the information that you got was accurate. I suppose you'd like to get to 100% contact tracing, but you're making a realistic assumption about what you might find in terms of the numbers of people. The questions, let's find those very quickly. John?
You to the member of the audience who sent that in. If anybody else is watching, any of the participants, feel free to chat in the chat room, type in any questions that you have.
So the first question for Kimi was, how do I protect myself from contracting COVID-19 from going to when I go back to the dentist for a routine checkup? Have you guys released, I guess the question is really, are there any protocols that have been released yet for the dental community about how to treat patients, and how is that being handled?
Right. So when I mentioned that we want to make sure that we have personal protective equipment for all healthcare providers, that's inclusive of our dental providers as well. And so we want to and will be making sure that all of our health system partners have guidance, know what they need to do in order to protect patients. And most of our healthcare providers do already know all of this and have all of this, but really making sure that they have the equipment that they need is the key element to this.
The second question, Kimi, is more related to this idea of a sub-regional approach, right? So we do have the county level, and then we have regions, sub-regions within the county. Is there any data-driven consideration to moving more quickly in sub-regions? Some areas, because of their geography, are probably have less cases than other areas. And I know you're looking at everything at a county level, but has there been any discussion or consideration being given to the sub-county, sub-regional areas within the county?
And so no, we have not at this time considered opening up different parts of the county based on the numbers in those arenas. One of the things that is really important for us to keep in mind is that when we're talking about communicable disease, and this actually was something that was considered by the governor and our state public health director, is after you open up, let's say, a county, you still have to really prevent that movement of people from other areas across those borders. And so there have been and are discussions still about making sure that we really contain traveling between counties a lot and different parts of the state. And that will be even more important when communities start to open back up. That's very challenging to open up and say, but stay in your area kind of thing. That's even more difficult inside of a county to say, okay, Dublin, you can open up, but you can't leave Dublin. No one can come in Dublin. No one can, we have people who work, and live in different parts of the county. And so practically speaking, it would be very difficult to do that, because opening up certain parts of our county is really like opening up the whole county. And so we want to be mindful of that. And so the traveling, we're very mobile people. And so,
Agreed. Okay, the next question is, given that increased testing will most certainly result in more infections detected, how will you know when the rate of infection starts to decrease so we can move into the next phase of shelter restrictions where they can be lessened and businesses can reopen? And that's really, Kimi, if I could, is that really more an issue of daily information and sort of trends over a period of weeks or days?
Yeah. And also too, the piece that I talked about earlier with regard to our health system capacity, that we want to make sure that, so let me back up by saying the caller or the person who posed that question is their assumption is correct. The more we test, the more we will detect. That is true. We have to have the ability to manage that. And we have to make sure that our hospital system and our healthcare system is not overrun. And so that's the reason why we're really taking these measured steps of making sure that a hospital surge capacity is still there. We are expecting that, yeah, as we test more, we will have more cases. But if we're able to also provide people with the supports and the services that they need to isolate, to quarantine, and to monitor them, that we can also possibly prevent people from staying positive without any intervention, without any help, getting sicker and sicker in silence kind of, and then, you know, going into the hospital. We want to be able to better manage all of that. And so it all kind of hangs together, but the caller is right about the increased numbers.
The next question is a related question. It really has to deal with this notion of flattening the curve. And on what does flattening the curve depend in the paradigm of increased new testing? So there were always going to be new cases. Flattening of the curve is again a function of looking at, is it looking at hospitalizations and number of patients in ICU versus number of tests, or, you know, what is really behind the idea of flattening the curve?
It's really preventing those sharp spikes that essentially crash our hospital system. That's essentially for the average person, for all of us, that's really what we want to hold on to. That all of the interventions, though, that we're proposing really go together as a package. But at the end of the day, if we don't have the capacity to hospitalize people who need to be in the hospital, then we won't have done well. And so that's the piece that we really want to make sure we're able to do. But all of the interventions do hang together, and it is really preventing those sharp spikes that crash the hospital system. Not just sharp spikes in numbers of new cases so much, but really the hospitalizations, as you pointed out, and ICU and those kinds of things.
So this question maybe you can answer by telling people where to find this information, but how this person wants to know how they can keep tabs on how extensive COVID-19 is in Dublin. So, I mean, so Alameda County Public Health now offers a couple of different dashboards for people to look at and understand basically the number of cumulative cases and the number of daily cases positive COVID-19, and they keep that information at a jurisdictional level when those numbers are above 10. Is that correct? Any number below 10, they don't disclose. And so right now, I believe the number in Dublin is somewhere around 25 or 26 and the cumulative cases, correct? So some of those folks could be recovered. Some of them could be active cases.
That's correct.
You know, one of the things that might drive that number up, if I could just interject for a moment, is the fact that we have opened up a testing center out here in the Tri-Valley, working with our partners in Livermore and Pleasanton. And so that is available at the Alameda County Fairgrounds. We are in the end of week 2. We're hoping we can go for another at least 2 weeks. There's a call this afternoon to see how we're doing on the number of tests. I'll say this, that the number of tests have dropped off this week then from last week. I think there was that that buildup and that pent up demand to get tested last week. But please, we highly encourage people to go get tested if they meet any of the criteria. And we have fairly broad criteria out here in the Tri-Valley to be tested. So we want to make sure that people are getting the care that they need and getting access to the testing that would help them get that care. And yeah, go ahead.
I just wanted to also add another point to the callers or the participants' question about the curve too. The sheltering in place and really physically distancing ourselves and the face covering, all of that helps to slow spread. And so, as I mentioned, all of the interventions go hand in hand, and although we might ramp up testing, we are not going to, and although we may loosen some restrictions, we're not loosening we're not loosening up on really trying to stay physically distanced, real face covering, universal for everyone, everywhere. That those are important components for preventing and slowing down transmission. So I just wanted to add that piece. I realized I hadn't spoken to that.
We received another question and it's more of a statement than a question. As we prepare to reopen in phases, is the health department being proactive in providing businesses with the best practices of what the new normal is based on their industry?
So what we have planned, what we are planning in discussions about is to really be able to provide technical assistance and information for businesses, as well as provide opportunities for best practices to be showcased for other businesses to see, oh, this is how this business is doing this. Here, you can take a look at this. The state is also having those same conversations. And so there's a general desire all around to share information about what works. And if a business has come up with a way to make their business safe, no need to reinvent the wheel. We would absolutely want businesses inside of that industry to follow suit and do those same things. So yes, we'll be in further conversations with business partners around how that whole process can look, but we are looking to do things just like that, yes.
And to that person who asked that question, I think the cities are working as closely as we can with the health department to make sure we get that information out to our business community. Many of us have economic development staff who have ongoing relationships with a lot of our key businesses, and to ensure that they are taking into account and posting all the notices that are necessary that detail out their protocols. And then it's incumbent upon our police department staff and others in the city to ensure that those things are being adhered to. There's a statement and then another question, and I'll say the statement knowing that I can't validate the statement. It says, or according to data from New York, most of their cases who test positive were from people who were actually staying at home. Do you have any thoughts about positive cases for people who have been staying home?
Yeah, I've heard that as well, but I don't have any information about what's behind that, so I really can't comment. Sorry.
That's okay. Mayor, that's all the chat questions we have and other questions.
I do know that, and we answered it on the chat, but let's just repeat it for the public. People asked, what are the times of the Tri-Valley Testing Center? It's 9 to 1, not open on weekends. And I do know that if they run out of tests even sooner than that, they'll close up. So get there early if you plan to go get tested. But with that, I would say, Miss Watkins-Tartt, thank you so much for being with us again. And I know it's maybe the second or third time you've been with us here in Dublin, and we're just one of the cities in Alameda County. You must do these quite often. Thank you. I thought it was very insightful to know that indeed the Bay Area counties are acting as a group. I will say I note that there are, I think, are some differences between Contra Costa and Alameda and other counties, but minor. I believe. I don't know that to be the case, but at least there's the 5 indicators that you mentioned. That's very helpful to know. Several of them we're doing very well on. A couple of them, one being ramping up and training for contact tracing is important. And we hope that maybe if we need to call on you in the future, you can join us again. But very insightful. Thank you.
Thank you for having
With that, we'll move to Ms. Smith. Would you like to give a brief update on the city? And then after that, we'll move to Chief Holmes. Is that a good next step?
Sounds great. Thank you very much. For the benefit of those on the call, I'm the city manager of the city of Dublin. I work and serve at the pleasure of the city council, and we have 5 city council members here in Dublin. My job is to, as Director of Emergency Services in this case, is to ensure that we are making all appropriate actions necessary to protect the health and the public. So the first thing that we've done in response to the COVID-19 pandemic is to activate our Emergency Operations Center, and primarily in the areas of logistics and planning and intelligence. In this regard, what we're doing is really trying to work with our community partners, our nonprofit communities, to ensure that people who need services get access to those services. So whether it's a need for food or our seniors who are homebound, that we can get meals to them. Our logistics team is working very closely with our nonprofit partners. And in fact, we have deployed some of city staff to go assist those nonprofits to make sure that people are getting meals. For example, at Open Heart Kitchen, who did not have the volunteer staff as a result of the pandemic, we've had some of our part-time employees over at the senior center preparing meals every day. When we started the pandemic, or mid-March for us, we had about 30 meals a day we were serving. We are over 100 meals a day that we're serving to seniors in our community. Separate from that, we activated and sent some resources over to Meals on Wheels to make sure that seniors who are homebound, who cannot pick up curbside meals from the senior center, are able to get fed as well. We've also extended that to ensure that people in our community who are disabled, which is not generally the profile of the persons under the Spectrum Meals on Wheels program, but we have gone ahead and we will be funding those meals for the disabled community. So if you are someone who has mobility challenges and you are unable to get a meal, you can reach out to Spectrum Meals on Wheels and you will be served here in the city of Dublin. We are also working closely with Tri-Valley Haven on food, just general food banking, and ensuring that we now have drivers that are full-time city staff working on behalf of Tri-Valley Haven and going and picking up bags of groceries from their facility in Livermore and driving them to our senior affordable housing apartments here in Dublin to make sure that seniors are getting the groceries that they need to prepare their meals. So we're doing a lot in that regard. We're also trying to prepare for and continually in response to the most recent orders with respect to our own city facilities. What you may not know was the last order, while it did release construction, which is, has an impact on the city's response to that, and it did indicate that outdoor businesses could move forward. The other component of that was it said that certain recreation programs and camps could move forward, provided that there were stable groups of 12 children in those groups, and it was only for essential workers. And for us, that's a huge undertaking to try and put together those camps, but we feel confident that we can do that and serve our essential worker community. So by the end of this month, if not sooner, we will be providing a very affordable program for our essential workers so that their children can get access to those camps while they help serve the communities that they are serving. So we wanted to make sure there will be more information to come out on that. It'll be called Camp Shannon, and we will make sure we keep the children in the way that we were instructed to do so by public health. We are also, as of last Tuesday night, the City Council took an action to make available loans, forgivable loans up to $10,000 per business to ensure that those that are struggling through this pandemic could potentially get access to those funds, really targeting our small retailers and restaurants, those mom and pops who don't have access to greater resources beyond perhaps what they have in the bank. So we want to make sure that those businesses can stay in business through this pandemic, even if they've had to modify significantly what they're doing. So those program details went out today to the public, and we're expecting to get a lot of response to that. So we have a fund of about $500,000 for businesses in our community, and we'd like to help as many as we can. In terms of the fiscal impact of all of this, we're not unlike a lot of other communities, but I would say we're very fortunate under the fiscal stewardship of this council and previous city councils. We are in decent financial shape, although this hurts. So it's at least $6 million in revenue for this fiscal year alone for the city in funding our ongoing operations. And we are expecting that to continue for a period of time, including into our next 2-year budget cycle. That next 2-year budget cycle will begin, and the council will adopt that budget in early June. So at this point, we're not seeing where we would need to necessarily make any major cuts in service, but what we need to do is make sure that our operations is adapted to what is the reality of the shelter-in-place orders and other social distancing orders that might continue on past the more restrictive setting that we're in today. And as Kimi had mentioned previously, the governor had released new guidance to be effective today. The county is taking a more stricter approach, and we, of course, follow the most strict orders that are in place at the time, so we will continue to do that. We also work very closely with Dublin Police Services. We and City of Dublin contract with the Alameda County Sheriff's Office to provide law enforcement services to our community. And we have the great fortune of having Garrett Holmes as our police chief, Commander Holmes from Alameda County Sheriff's Office. And I can turn it over to Garrett to talk a little bit about what he's been doing in this regard in terms of the enforcement of the order.
Thanks, Linda. Since the beginning of the pandemic, our crime prevention unit has really taken the lead on educating and engaging with the residents and the business community. Initially, we worked with economic development to identify the businesses that fall under the essential services. And we went out and worked with those businesses to make sure that the ones that could stay open, they were open, and then they were operating under the conditions of the order. And then the other ones who were not supposed to be opening, we made sure that they were closing their doors. We've done a lot of community outreach with going out and contacting the care facilities within our community, making sure that they have the proper PPE and they're taking the necessary precautions so that the patients that they're serving are taken care of. And we also recently hosted a neighborhood watch Zoom meeting to get the information out in regards to the latest orders. You know, I don't know what iteration we're on now, if it's like the 4th or 5th iteration of the order, but you know, every time that comes out, our personnel is reading that order, digesting it, understanding it, and then going out and then re-educating the community to make sure that, you know, we can comply with those orders. We have seen a significant reduction in criminal activity initially. Our calls for service and reports are down about 30–40%. And that was primarily because a lot of people were following the shelter in place. You know, you probably have seen some media inquiries where some folks are, with not as many cars on the road, people are taking advantage of being able to drive a little bit faster. I know our CHP office here in town, the fatal wrecks are up because people are driving too fast, and we really need people to slow down on the roadways. I know that was one of the questions here about people speeding in the residential communities. And if you contact the police department, you know, let us know the specific area in town. You know, we can definitely go out there, and we're starting to do some more traffic enforcement as things go on here. We have seen about a 50% increase in the area of domestic violence, which is disturbing. And, you know, we have been going out there and working with the victims of those crimes and making sure that we direct them to the resources that are available to them. And then we have seen about a 30% increase in our mental health calls for service. And so there are a lot of people who are experiencing mental health issues, and we're making sure that we direct them to the resources that they need as well. So that's kind of a snapshot of what we're seeing here at the police station.
Great. Ms. Smith, anything else?
No, we did get a couple of additional questions in our Q&A section of the Zoom call, and it really relates to any data around senior areas in Dublin and any planning around that. And I think that information, we don't have any other than we have, according to Chief Holmes, we don't have any congregate care communities in Dublin at this time. What we have are these these are individual residential community homes, correct? And when we talk about seniors who are living in those sort of care settings.
Yeah, there's people with various medical needs and disabilities that we have some facilities. I want to say we roughly have maybe a dozen to 15 that are in the community, and most people that they take care of at any one facility is 6 people.
So we have a fairly good handle on the number that we have in our community. Aside from that, we have 3 affordable senior housing communities. And then 2 of those have nonprofit entities on site, abode services, who are probably keeping track of the health and welfare of those tenants. And then we also have another one called the Groves. And, you know, we can check in to see where we're at with that. I don't have specific information about that, but we do not have these large nursing care communities that perhaps exist in other parts of the county, where they're starting to see, you know, infection rates in those centers that are more medically based centers. And then let me double check, make sure I don't have any, that was it. Or there's any plan for testing for these high risk areas at this point in time? I don't know if the county is planning to do any testing at those facilities where these nursing homes and care facilities are.
So we have a long-term care facility task force, and we have just recently, that we've had on board for quite a while during this response, who really, that team works very closely with long-term care facilities to identify cases, test, and support the whole entity. We recently also started conversations about actually launching another team of people to work with those homes that are unlicensed or smaller, to provide the technical assistance and support. And so we always want to be available to provide guidance and support, so that members who in our community who are vulnerable and medically fragile don't get ill. So yes, but we don't have plans right now for a whole testing campaign, I would say, right at the moment, but we are pulling together and have pulled together a team to provide guidance and technical assistance, though, for the exact type of homes that you're referring to.
Mayor, that is the totality of the questions that we've received.
Ms. Smith, could I ask a couple of extra questions, which I just know are on people's minds? It may not be completely health related, but everybody is going to be asking, what about 4th of July? What about the farmers market and maybe concerts over the summer? I'm going to guess that we have talked about this, but when are we going to start making decisions, and/or how's that going to look, if we even know? And if we don't know right now, that's fine, but I'm sure we'll know soon enough. Just let us know what's going on. I get asked these questions, both of them, once a day.
So I can say on this, I saw Kimi's eyes kind of widen there for a minute. I don't anticipate us seeing any change in social distancing practices throughout the summer or mass gatherings. There are things that we need to work with public health on. For example, in Dublin, we do allow the sale of safe and sane fireworks. And those don't occur until the end of June. I don't know what the order is going to look like at the end of May. So it's difficult for me to say yes or no to that at this point in time. What I can say is that we would not be opening up parks for people to gather to use their safe and sane fireworks. If they were to use them, they could use them with their own household at their own place of residence. That might not be what people can do. Those are decision points we're going to have to make. We probably aren't going to make that decision until the end of the month, when we have kind of a better sense of where we're headed. There probably, and I can't imagine a scenario where we would be having concerts this summer. We're already trying to think about our events for the fall and whether or not we can continue our events for the fall. Last call I had heard Dr. Pan on had suggested that we will be doing these practices about mass gatherings and social distancing long after perhaps the more restrictive shelter-in-place orders are in effect. So I don't know if Kimi wants to address that. I know I've heard that, but I don't want to speak on behalf of public health on that question. Everything that we're going to be doing here at the city is going to be in compliance with the order. There is a lot of, sometimes there's a lot of gray area and we need clarification on those gray areas. One of those for us will be as an elected body when you might meet again in person, and how many people, if there's an item that's of significant interest to the community, when would it be appropriate to start meeting in person again? So those are things that we're going to have to kind of work through and be working with public health to help us guide those kinds of decisions.
So we'll stay tuned for more time to go by for us to think about these things. I know sometimes you make it look so easy, but so much goes into making these types of decisions, and different variables that you have to consider, different gray areas that you have to get validation and checking on so that we're doing the right thing. It's not as easy as flipping a coin or making a rash decision. So much goes into even what might seem like an easy or small decision. None of them are. So thank you for making the tough job look easy, but we want everyone to know that we're being mindful and we're being compliant, and that it's really, I know, agonizing at times to make these decisions the way we have to make them. So thank you for that. With that, I'll say we've concluded, come to the end of the session here. A great informative session. Thank you, Ms. Watkins-Tartt, Kimi Watkins-Tartt from the Alameda County Public Health Department, for sticking on throughout the entire call, to Ms. Smith, our city manager, doing a tough job day in and day out, and to Chief Garrett Holmes, keeping us safe and explaining a little bit about how our statistics are looking today. With that, I will say thank you to all our panelists. Thank you for everyone who watched and asked a question. And if anybody would like to see this, we recorded and we'll be posting to our website. If anybody has questions, they can refer back to it. And if we have questions come up, we can refer people to this recording. Thank you again. And with that, we will adjourn this community conversation and say thank you, everyone, again for attending. Take care.
Thank you.
Stay home and be safe.